I'm Dr. Gurudat Bhatt, consultant pediatrician from कल्याण. आज हम लोग एक बहुत अच्छा इनिशिएटिव स्टार्ट करने जा रहे हैं, शुभारंभ करने जा रहे हैं, चाय पे चर्चा. ये प्रोग्राम है यंग नए पीडियाट्रिशियन, एक्सपीरियंस पीडियाट्रिशियन और हमारी 25,000 से ज़्यादा पीडियाट्रिशियंस की फैमिली है इंडिया की, उनके लिए. ये एजुकेशनल इनिशिएटिव है, डिजिटल एजुकेशनल इनिशिएटिव है बाय डॉक्टर Bakul Parekh, who is a senior pediatrician with 35 years experience in Mumbai and runs a multi-speciality pediatric hospital in Mumbai. He is also the secretary of IAP national body, and I would take great pleasure today in inaugurating this fun program and inviting Dr. Bakul Parekh, our speaker. Dr. Bakul. So nice to have you.
I'm nice to see you. So hi Gurudat, how are you?
Fine sir. Nice
Meeting after a very long time.
Yes sir.
Yeah, I think today's topic is very important for the young pediatricians who want to start their practice and what challenges they face.
Right.
So let us discuss and come to some conclusion which may be useful to them.
Right sir.
So you can ask me whatever suggestions or questions you have.
Okay. Welcome Dr. Bakul Parekh. As you know, Dr. Bakul Parekh is a well-known pediatrician from Mumbai with 35 years of practice in private, and he's also the secretary of the Central IAP. We start this Chai Pe Charcha regarding challenges faced by young pediatricians with the first question. Sir, we would like to have your views on the challenges faced by young pediatricians or young graduates from medical colleges who just enter pediatrics.
Yeah, it's a very important question, but at the same time it is not a simple answer. Because a pediatrician who passes a degree like MD or DCH and he starts thinking about what to do further, there are 3 or 4 angles to that. A person may be very good in academics, he wants to become a teacher and he likes to be with students. So for him there is no option but to join a medical teaching college, where even if he is financially strong or weak, he will get enough pay which will make him sustain his life with some luxury. Also, he has that itch of teaching, so that is satisfied. He gets to teach them or rather work there in the hospital from 9 to 5, and after 5 is free to do his own practice or maybe whatever he wants. Secondly, he gets enough vacations, enough perks, so he has a very good family life and he can spend quality life with his wife or his kids. So that helps in his future. But the only disadvantage here is that he is controlled by the college ethics and rules. Sometimes he may have to follow the opinion of other colleagues which he may not like. Also he is driven by politics of the hospital, and other politicians from outside also can put pressure on him. He has administrative headaches, and sometimes they are so much that I have seen some doctors who are very good in academics but they spend lots of time in only administration. And over and above, if he is really a brilliant student, then he may come up well and develop his own reputation, and later on he may think of starting his own private practice. The other side is that a doctor may immediately start to think that I will start my private practice directly without getting attached, which I will not agree to, because a doctor before starting his practice he has to have enough experience of seeing variety of patients, variety of emergencies, how to talk to patients, how to convince and explain patients in their own language, and other parts of hospital administration and financial management. So that he gains only by joining as a senior registrar or as a lecturer with a corporate hospital or a medical college, or a senior pediatrician who is successful in his private practice and is having his private setup. And that's how he will pick up over a period of time, say maybe 6 months or a year, that how to deal with patients in private. So these are 2 options which I think all the young pediatricians can look at.
So sir, in your opinion, the first or the best first job for a full-time job for a new pediatrician is in a medical college and the beginning of their career. That will be the right answer. Yeah. But sir, there is a contrary idea that you should sink or swim, just jump into private practice straight away from your graduation from day one. What is your view on this?
Yeah, as I told you, if he is academically oriented and is likely to be a teacher, for them there is no option but to join. But for a private practitioner who is really not inclined to become a teacher, but he is academically so-so and he wants to do well in practice, I will always feel that he should join a practice wherein he can pick up some experience, look at the variety of patients, face some emergencies, and then come out with that experience which will help him, because what you learn in college is knowledge, but what you learn in practice is wisdom, and combination of both is very important for becoming a successful practitioner.
Nowadays, in especially the bigger cities, a lot of corporate hospitals, private setups with big setups with a lot of facilities, a lot of high-level care, which is like the care in the developed countries, are available, and they are also giving fairly good pay. So, is it a good option for a new pediatrician?
First of all, I will say that it is very difficult to get this type of attachment for a general pediatrician. Only way he can get attachment in this type of places or get to work in this type of hospital is by becoming a senior registrar or an intensivist. Unless until you are a super specialty, it is very difficult to get in. But if you get the chance, then it's a good idea to be in corporate hospital and earn good money, and without any headache of administration, financial management, marketing, which we otherwise face in private practice when we start your own hospital. But only bad part about it is that there is a ceiling on your pay. After some time you start feeling that hospital is earning more and they are giving very less to the doctor. That pinch is always there. Plus you are having peer review, so sometimes you have a competition with your other colleagues who are also working in the same field. And thirdly, generally it is seen that in corporate hospitals the charges are very high. So all your patients may not be able to face that financial challenge. And secondly, they are always taken as objects. How to earn out of this patient. Also, the doctor is pressurized to send X number of patients for investigations, X number of cross references, and you are forced to do certain things which you don't like to. So all these negative points also hinders me in telling a young practitioner to go directly and get attachment to a corporate hospital. But okay, you want to get an experience of how to treat a patient, an emergency, you may get attachment or work there as a senior resident and then come out and start your own practice.
So, in extension of your answers, so many pediatric super specialties are coming up in cardiology, neurology, neonatology. And is it now impossible for a pediatrician, a generalist, to start practice in private?
I think everybody has his role. Our population is so high that only super specialists will not be able to satisfy the need. There are not enough numbers to take care of all the patients. First. Second, patient will not know to which specialist to go. A problem which he faces or she faces, she may not be able to select the right person. And thirdly, the transport and the availability and the nearness of the hospital and the emergency part. So always patient prefers to go to the nearest possible practitioner and the hospital where his patient can be taken care of, and then he will be guided by that particular doctor as to which specialist to go to. So always general pediatrician has a role, and you can compare this with a situation which was around few years back when family physicians were very important and they were referring them to the consultants. So same way, a general pediatrician has now become very important for the child population, and then he directs them to the right person and the right specialist. That is the ideal situation now.
So the stories of the death of general practitioners and general pediatricians are highly exaggerated. That's very nice, sir. So nowadays we see a lot of medico-legal problems being faced in everyday practice, and you have a growing sense of doctors feeling insecure. So we have a concept of group practice where multiple doctors, pediatricians or other specialties come together and start practicing together. They share their costs, they share their headaches, they share their emergencies, they have better quality of life. So what is your opinion on group practice?
I think that's a very excellent idea, because nowadays patients want the best, and if you start your hospital alone, it is going to be a low budget hospital initially, and you will have limited facilities, and then you will tend to refer these patients to the higher hospitals, and then you may lose the patient's confidence. Secondly, by joining in group, as you rightly said, there are so many administrative headaches, staff crunch, financial problems, approaching government and the municipality for various problems. There are certain rules coming in for fire and pollution control and all those things. So if you have a group, then you can share these responsibilities. Plus, you can have a very good life, family life. You can spare quality time with your family because the other doctors are there to adjust. You can remain, say, once or twice in a week on call, and other doctors will be taking care otherwise. So group practice in general is a very good idea. But only thing is that our Indian mentality is still not very much suited to it, because I have seen many examples where they have started group practice initially and then they have parted for various trivial reasons. There are many competitors who will try to fill in your mind something wrong and negative about your partner, and then you break. Like husband and wife, also if they have no understanding, they can get divorced. So same way, in a group practice, you require to have a good understanding, love for each other, respect for each other, and also let go attitude. If you don't have that, then please don't enter into the group practice.
An important question, sir, is for newly graduated female pediatricians, because they have a hard time juggling home, kids, husband, practice and finances, etc. So any advice for them?
Yeah, it's a very important question, because a female who gets recently married, she has to take care of the family, the kids and the practice. So it is a very challenging situation for them as compared to a male. But then I have seen quite a few doctors, inclusive of my wife, who has really managed well. Yes, she has managed me well, my hospital well and my kids well, by practicing fixed hours for consulting, say for 9 to 2. But for emergency she is always available, and when she is not available, either she keeps an assistant or she keeps help of the neighboring consultant of the same field. So whenever she is not available, the other person comes and attends and he gets the fees. But the patient is definitely taken care of. So in that sense, you can still manage this type of practice very well, but with the effect of some financial loss. But that loss is worth for buying a piece. So I think it is possible, and it's not that very difficult as it looks apparently in the first sight.
That's a wonderful idea, that idea of assistants. What is your opinion on assistants? What do you think that assistants, the new pediatricians who are coming up, how they can work as assistants?
Yeah, again, this is a very important aspect of our practice. We should be prepared to pay our assistants. That will give you peace and quality of life. As you progress, your practice is bound to increase. And over a number of years, initial 10 years, okay, you can work very hard, work all 24 hours, attend to the patients anytime when they call. But as the time passes, you will feel the pinch of it. And to get the quality of practice, quality of life both together, you have to have an assistant. And you can keep one assistant, two assistants, or three assistants who will help you in two ways. One, in sharing your load of work. Secondly, they will bring in new technology and new knowledge. Now, as the years pass on, the medical science is dynamic. It keeps changing. What I had learned 35 years back, now is topsy-turvy. What were indications initially, now they are contraindications. So it's so fast changing. So by new doctors coming in, he will keep you on toes. Your knowledge will be always updated, and you will be able to treat your patients in a better manner. And also you will get some time for your family also.
That's very good news for the new pediatricians. But the most important thing, or the most important fact, fear, whatever you want to call it, the new pediatricians face is a huge amount of competition. Urban areas have too many pediatricians, so many senior people who have established practice. So what would you advise the new pediatricians?
Every suburb has more than 50 pediatricians practicing. But mind you, our population is also increasing by leaps and bounds. And patients are going to face various situations where sometimes their old pediatrician or a non-pediatrician is not available. So in emergencies, definitely they are going to go to a doctor who is available. So the young generation, the young pediatrician is bound to be available all 24 hours, is ready to work hard, and is bound to get these patients when the other doctors are not available in the initial phase. And when is exposed, that patient is exposed to this particular doctor, and he feels that this doctor is also equally good and he gives results, then is likely to follow up with that particular doctor. Secondly, the charges. The senior doctor's charges are definitely going to be higher than the one who starts his practice now. So that also may make some difference. Thirdly, that doctor always should try to get more attachments to maternity homes, so that the families always believe that when a newborn is born and the doctor who has seen that newborn, he has caught his nerve, उसकी नस पकड़ ली है, फिर वो डॉक्टर को छोड़ता नहीं है. So they keep going to the same doctor for vaccination and then various problems. So that's how we can capture few target population or few target children with him, and then from 10 to 100, 100 to 200, and then it expands depending upon the doctor's capacity, his knowledge and his approach. So I am sure every pediatrician who starts his practice in any area has a place. It may take some time here and there. Maybe somebody will be established immediately, somebody may take few years, but if he keeps patience, he keeps hopes, and is dedicated, he is bound to be successful.
And what do you want to say about bad mouthing the competition? Is there a good way to get to?
Yeah, there is also a very important point, because we have seen many times new doctors, they find shortcuts by abusing some other doctors, or will say for example, a patient has fever for 5 days. It is likely to be viral fever. and that patient goes to another doctor because fever has not subsided in those 5 days, and then the other doctor says, no, you are suffering from malaria and I am giving you some medicine and within 2 days you will be alright. Though we know that the viral fever is bound to be okay in 2 days, but then that patient feels that the senior doctor missed malaria and this doctor has picked up malaria. So this is a very wrong technique. By using this technique, initially you may capture 1 or 2 patients, but then ultimately you are the loser, because every doctor, if they start talking against each other, then the doctor community is going to be blamed and everybody will be a loser. So it's better that you, if you don't want to talk against somebody or not good for somebody, at least keep mum and say, okay, now you have come to me, further treatment I will do, past I don't know. At least that much you can do, rather than abusing somebody else.
That is a very important message. And my last question is regarding a new setup. You have finished 35 years in practice. I'm sure you have seen the bad, the good. You have seen the days when you were in a new pediatrician and now you are the senior most pediatrician in your area. So what would you like to say about new setups and the challenges facing new setups?
I can tell you very vividly, when I started my practice, our family, we were staying 7 people in one room. And my father was a professor who has just retired. But to my luck, my father told me, don't worry about our family expenditure. You take your own decisions. You may take calculated risk. And I will tell you, without taking a calculated risk, nobody can be successful. Every successful person has taken some risk. You cannot be just sitting tight and be very risk-free and be successful. You have to take some risk. Secondly, when you start a practice, when I started my practice, in my area there were no polyclinics. Then I had to convince one person who was having a hospital, surgeon, that please give me one corner to practice so that I can start my practice. And then for first 6 months, I was looking at only free of charge patients coming from relatives and friends without any money. And in fact, I thought of going to Dubai, that I will not be successful here and I will earn something, and I fixed a job in Dubai through my uncle. But my father said, you are the only child, try for a few more months. And to my luck, after the 6 months, or one day when I went to the clinic, there were 25 patients waiting. So in fact, I asked my receptionist, have I come in the wrong time? So she said, no, these are your patients. And I was so pleasantly surprised. So the patients which I seen free of charge, and those patients, they had got good results, they had developed good impression about me, and that probably from mouth to mouth is spread, and then gradually my practice started, and from that day onwards I have never looked back. So a new practitioner should be patient enough to wait and do his or her practice sincerely, and it should be available all the time whenever patient needs you, and patient should feel that you are the right doctor for him or her, and you are going to be always available when he needs you, and then you are definitely bound to be successful. And then when I became successful, within 2 years I started a small nursing home on rental. I took that hospital which was run by some other doctor, but he was not interested. So that 10-bedded hospital I took on rental. I remember distinctly I had paid 5 lakhs as deposit and I was paying 5,100 rupees per month, and I continued for 1 year. It was a 10-bedded hospital, but then my patients were finding no beds in my hospital. That's how my practice increased. So then I went for a loan, and that time banks were not very easy to give loan. So I took 3,84,000 by visiting 10 times to Makers Bhavan in Mumbai, and I got that loan, and then some other loans from my friends and families. I could start my hospital with 15 beds, and from that 15 beds now I am running a hospital of 50 beds with tertiary care. So you have to increase your practice step by step, taking financial help, working hard, and try to see from where you can earn. But in that line, you should never forget that you should not enter into malpractice. You should not try to earn money by wrong ways. If you stick to the right treatment, advise your patients rightly, and you are sincere and honest, you are bound to be successful. Don't go for shortcuts.
Yeah. Thank you so much, sir. Excellent interaction with you. I really had a good time talking to you.
Yeah.
And so many nice ideas and concepts which you have shared with us today. I think they will be very helpful for every new pediatrician who graduates, say from today or in the next few years. Thank you.
I am very happy that you brought out what I had in my mind, and I am very sure this is going to be helpful to the young pediatricians. And even after looking at and listening to us, if they have any queries, they can always ask us through our contact details. Thank you very much.